Breastfeed during pregnancy. When a mother breastfeeds her child for several months or years, it is possible that she will become pregnant again during this period. She can then choose to continue breastfeeding her child. Among the reasons given for continuing, some mothers mention the fact that their child still needed these moments of closeness and was not ready to be weaned. Although some people raise questions about the safety of breastfeeding during pregnancy, this practice poses no health risks to the mother, fetus, or nursing child. What are the effects of breastfeeding during pregnancy? The effects of breastfeeding during pregnancy are not well studied. The few existing data, however, seem to indicate that there are few risks associated with breastfeeding during pregnancy if the mother is healthy, if her pregnancy is progressing normally, and if she has not experienced a high-risk pregnancy in the past. Here are some common breastfeeding concerns during pregnancy. Miscarriages and premature birth. When breastfeeding, a hormone called oxytocin is released. Since this hormone is responsible for contractions during childbirth, some mothers worry that breastfeeding during pregnancy could trigger miscarriage or premature labor. However, oxytocin is not produced in sufficient quantities during feedings to induce labor. In addition, pregnancy hormones block the effect of oxytocin. The uterus is therefore less sensitive to it until the moment of childbirth. Finally, contractions also occur during sex and therefore do not represent a danger during a normal pregnancy. A few small studies have also concluded that women who breastfeed are not more likely to experience a miscarriage or give birth prematurely. However, these studies were carried out with women whose pregnancies were progressing normally. Those who are at risk of giving birth before the expected date should therefore discuss their situation with their doctor before making the decision to continue breastfeeding. The development of the fetus. Producing milk requires a lot of energy. In theory, breastfeeding during pregnancy could therefore limit the resources available to the fetus. However, if the mother is feeding well, most experts agree that the baby's growth is unlikely to be compromised. Studies on the subject also conclude that breastfeeding has little or no effect on the birth weight of the new baby. Mother's health. Breastfeeding and being pregnant are demanding on the mother's body. A study has noted that some women who breastfeed during pregnancy have a lower level of hemoglobin, which increases their risk of suffering from anemia. It is also recommended to take a prenatal multivitamin containing folic acid and iron. However, the nutritional risks for the mother are low if she is well nourished. It is therefore important for women who breastfeed during pregnancy to have a varied and balanced diet, rich in iron, vitamins, proteins, and minerals, and to be well hydrated. Become pregnant while breastfeeding? Breastfeeding greatly reduces the chances of conceiving a new baby, especially if the following three conditions are met. Menstruation has not returned and no bleeding has been observed. The baby feeds at least every 4 hours during the day and every 6 hours at night. Breastfeeding is done without following a schedule and without limiting the duration of feedings. The baby is exclusively breastfed, that is, he does not receive any commercial formula, food or water. The baby is less than 6 months old. As soon as one of these conditions is not met, however, breastfeeding can no longer be considered an effective method of contraception. Does pregnancy affect the milk the breastfed child drinks? During pregnancy, the presence of certain hormones conflicts with milk production. Many mothers may thus notice a drop in their production from the first half of pregnancy, especially during the second trimester. If the breastfed child has started solid foods, this reduction is less of a problem since breast milk is no longer his only food. However, if he is less than 6 months old and is still exclusively breastfed, the amount of milk produced could become insufficient. It is therefore advisable to meet with a lactation consultant to determine if it is possible to increase milk production. Otherwise, the child may need a supplement, such as a mother's milk frozen before the start of pregnancy. If the mother does not have sufficient breast milk, commercial infant formula could be used. These changes can also modify the composition of the milk. For example, in the first 2 months of pregnancy, the concentration of protein, sodium, and chlorine increases, while the amount of potassium, lactose, and glucose decrease. The milk can then take on a salty taste. Even if some children may then refuse the breast, these modifications to the composition of the milk will not influence its development. Some children may also be upset by these changes and lose interest in breastfeeding. A survey of women who breastfed during their pregnancy also revealed that, in 69% of cases, weaning took place during the second trimester. Breastfeeding discomforts during pregnancy. About 75% of women who breastfeed during pregnancy report having more sensitive nipples. This discomfort would be attributable to ongoing hormonal changes. Unfortunately, most of the treatments recommended for sore nipples are usually not very effective during pregnancy. To reduce unpleasant sensations, some mothers use breathing techniques. It is also best to make sure the child is latching on properly. An evaluation by a lactation consultant may then be necessary. In addition, some mothers report feeling emotional discomfort when breastfeeding during pregnancy. Some women describe this emotion as a feeling of annoyance or irritability. To manage this discomfort, it is suggested to distract yourself during breastfeeding by reading or listening to music, for example. Breathing techniques are also a good option. Finally, towards the end of pregnancy, the growing belly of the mother sometimes makes breastfeeding more difficult. Breastfeeding lying down can then be a solution. If the child is old enough, the mother can also ask for her cooperation in finding a comfortable position. The withdrawal? If a mother cannot find a solution to be comfortable breastfeeding during pregnancy, she may choose to wean her child. Some strategies like don't refuse or offering a distraction are effective in gradually weaning an older child. By offering cuddles and lots of attention to the child, it is entirely possible to meet his needs without breastfeeding him. To remember, in the absence of contraindications, breastfeeding during pregnancy does not pose any risks to the fetus, the breastfed child or the mother. The mother's milk production can decrease from the first half of pregnancy. Some pregnant women may experience small inconveniences during feedings, but solutions exist to manage the situation.